Hey everyone, I'm Beth Winkler, physical therapist and owner of Magnolia Physical Therapy in New Orleans. I just wanted to demonstrate a few exercises for patients who are having low back pain. So what I'm going to do is, in this first series, is do more of a basic lower level. So if you're having a lot of pain, having a hard time moving around, these are what we call phase 1 stabilization exercises. These are more for a little bit mobility of the spine, but also just to get things moving a little bit and getting those muscles woken up. Anyway, okay, so the first one here is called a pelvic tilt. So what you want to do first is get comfortable lying on your back or on a bed. And what you're going to do to find, you want to find your neutral spine. So you're going to flatten your small of your back into the floor, and then you're going to arch it to make like a space underneath. Okay, so I want you to kind of do that a couple of times. Arch and then flatten. And what I want you to do is find a spot right in the middle that feels neutral to you. Everybody's neutral is going to be a little bit different depending on if you have a sway back or a flat back. So find that neutral spine. Okay, and then what I want you to do is hold that neutral spine, and I want you to imagine that there is a string from your belly button pulling down from the bottom of the floor, so from the earth. So what you want to do is imagine your belly button pulling down and pushing down into the small of your back into the ground. What you don't want to do is lose your neutral position, so make sure you keep that nice and firm and still, and then pull in. So pull in. Hold that for 3 breaths, and then relax. The reason I like to do it for 3 breaths is because people tend to hold their breath when they're doing that. So instead of counting, make sure you're doing breaths while you're holding that and engaging your core at the same time. So once you find the neutral spine, go ahead and do that exercise, holding for 3 to 5 breaths, and repeat that 10 times. And do that throughout the day. I like to have a routine. So if you have a morning routine, after you brush your teeth, do it. After you eat your lunch, do it. Then before you go to bed, do it. The second exercise, second 2, I'm going to show you a more for mobility. This next one, and again, if you have any pain or discomfort with these, really work within your comfort range. Okay, so here you're going to find that neutral spine again. Hold it in. You want to make sure that your middle doesn't move around. And then you're going to bring your left knee up towards the chest and then release. And then the right, and you're going to alternate here. So this looks like you're just moving your legs, but when you lift your right leg up, your lower spine is having to flex to accommodate that. So you're going to do about 15 on each side and repeat that cycle twice. Okay, the next one is a lower trunk rotation. This is more for the rotation of your spinal joints. You're going to lie with your knees bent, and then you're just going to rotate right and then left. Try to make sure you keep the small of your back flat. It's going to come up a little bit when you go to the side, but you don't want it to be all the way over like that, okay? And again, if you're in neutral and then you start going to the side and you get to the end and that really hurts, just back it up a little bit. Stay within your comfort range. Okay, even if you're just moving a very small range, you're getting movement and fluid going through those joints. So it's okay. I'd rather you move within your comfort zone than push into pain, and then the exercise is not really beneficial that way. So there are phase 1 low back exercises. If you have any questions, feel free to email me at bethw@magnoliatherapyla.com. I'm happy to modify any of those exercises. We're also doing telehealth visits with all of our therapists in our clinics in New Orleans. To schedule those, you could call 504-733-0254 or go visit our website, magnoliatherapyla.com, and you can click on the request an appointment. So here's to staying pain-free.